Okay. Good Monday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to all of those who are serving our fellow community members, Our nonprofit organizations, hospitals, medical providers, churches, employers, neighbors, and the many others who've stepped up to provide much needed services, care, and support to the members of our community when they need it most. Thank you. Regarding our local situation, we have 1,296 confirmed cases of COVID-19 in Knox County. Additionally, we have 30 probable cases. 792 of our cases have recovered, giving us 495 active cases. 92 individuals have been hospitalized at some point in their illness. 20 Knox County residents are currently hospitalized. I'm deeply saddened to report that since Friday, 3 additional Knox County residents have passed away from complications of COVID-19. This brings our total in Knox County to 9. To all the families and friends who've lost loved ones, please know that our hearts and prayers of our entire team are with you. We've received lots of questions about how and when we'll update our COVID-19 information given the Board of Health's involvement. We want you to know we continue to update the Knox County case counts, hospitalizations, active cases, recoveries, and deaths every day on our website, 7 days a week. covid.knoxcountytn.gov. And we will continue to update our 5 benchmarks weekly. These benchmarks are the big picture information that provides an assessment of the local situation and our community's ability to respond. I do want to take a few moments to discuss face coverings in the order the Board of Health adopted last week. It is disheartening that these little things have become an unfortunate politicized symbol when they really are just a simple safety measure that helps protect our community. In the same vein as seatbelts, life jackets, and speed limits. We've heard from many of you over the past several weeks through emails, phone calls, and social media on both sides of this unfortunate divide. Please know that we hear you. We're listening and we respect you. Much of the frustrations on both sides seems to be based on misinformation, confusion, or simple misunderstandings. And while I can't, unfortunately, heal some of the divides or change what this has come to represent for so many, as your public health officer, it is my responsibility to share the facts. First, let's talk about the science behind face coverings. To start, it's important to point out that this is a novel or new virus. The worldwide medical community is still learning about this virus, including how it spreads. In the beginning, the medical community didn't recommend healthy people wear masks as a way to protect themselves. This was based on the fact that the medical community didn't have the evidence yet of pre-symptomatic or asymptomatic spread, and because we were preserving PPE for our medical providers. As we learned about the prevalence of pre-symptomatic and asymptomatic spread and examined evidence that even a simple cloth face covering could block many droplets from reaching others, the recommendation changed. Remember, wearing a face covering reduces the chances of someone who has no symptoms or very mild symptoms and doesn't think they're sick from spreading this to others. The recommendation for everyone to wear cloth face coverings was not based on a notion that would protect the wearer. It was based on new evidence of how the disease spreads from people who don't feel sick very regularly. So my mask protects you and your mask protects me, as we've said many times. While it's frustrating when guidance changes, you want your medical community to follow the evidence when they learn more. It would be unacceptable if you learned new information and did nothing with it. Wearing a cloth face covering when you can't socially distance is a recommendation from the CDC, Tennessee Department of Health, the U.S. Surgeon General, the American Medical Association, the American Hospital Association, the American Nursing Association, area hospitals, and the National Institutes of Health and Johns Hopkins, just to name a few. So let's talk about when you need to wear it. When you are in public places, when at least 6 feet of distancing cannot be maintained. The Board of Health's decision last week means it is now required in most indoor public spaces. You don't need to wear a mask when you are only around those you live with, or when you're outdoors and at least 6 feet of distancing can be maintained. Excuse me. As we get through this, I ask everyone to show kindness to others. Whether you agree with wearing a face covering or not, it helps no one when we are unkind to others. Now let's talk about the authority and how this regulation can be passed by the Board of Health. Both the membership of the Board of Health, including how they are selected, and their authority is outlined in the Tennessee Code Annotated, beginning with section 68 to 601. It states in part, the powers and duties of the county boards of health include adopting rules and regulations as may be necessary or appropriate to protect the general health and safety of the citizens of the county. The order the board passed, which is available in full on our website, includes additional information about the board's authority. Some of you asked why the board excluded certain locations, such as churches, state and federal buildings. That is simply a jurisdictional matter, meaning the Board of Health does not have jurisdiction over these locations. While the governor gave the 6 metropolitan counties with local health departments, including Knox, the authority to issue orders that are more or less restrictive than his, he excluded certain entities from local control. These exclusions include places of worship, long-term care facilities, and others. So there's jurisdictional limitations, and the governor's order also placed some limitations on there. And finally, many of you have asked how the board plans to enforce this new regulation. The board did discuss enforcement at the meeting last week and agreed the intent is to issue warnings and, if possible, provide face masks to those who do not have one. Additionally, per item number 11 in the order, the board has formally requested local governments to support the enforcement, explanation, and clarifications of the regulation. I read this order for the first time last Wednesday, along with the rest of the board. I do not have all the answers yet, but we are working to support the board in this area. In the meantime, those concerned about violations are encouraged to call 311 or our phone bank at 215-5555 so the complaints can be filed. Complaints about organizations that the health department permits, restaurants, grocery stores, and others, will be addressed by our environmental health division. We will work with our community partners and other local governments to address other complaints. I know this is a frustrating and scary time for all of you, or all of us, but I also know who we are as a community. Whether you agree with the board's decision or not, I encourage you to take a step back from all of this and take care of yourselves. Sometimes the intensity of social media, the news, and the trying situations of the day can be overwhelming. And while we may not all agree on the best path forward, I think we share the same goal in the end. And please remember, we really are in this together. Now I'll open it up for questions.
All right, if you'd like to go ahead and submit your questions in the chat feature. First question from WBLT, David at WBLT. We wanted to ask you about what mask enforcement is looking like, who will be doing so, what is the punishment, and how will they go about it?
So as was stated by the board and stated by me earlier, our primary tool will continue to be informing, educating, and enabling people and businesses to be compliant with this mandate. Outside that, we'll follow our regular process. We are still working with our other community partners that would be involved and exactly what that looks like for them as well. So since this just went into effect, we haven't had time to get all the things in place yet, but we'll follow. We have some routine ways that we communicate with those we regulate to help them be compliant.
Also from David at WBLT, how many calls or complaints has KCHD received on masks in the 3 days the order has been in effect?
I do not have that specific information in front of me, but we can find out.
From Paul at WBIR, if I get tested at the health department today, when can I expect my results back? And the second part is, if you think you've been exposed, how long should you wait before getting tested?
I'm looking at.
So that
Our turnaround time currently is about 4 to 5 days.
We're telling people around 7 days,
Okay.
just to be on the safe side, but in general, it's on average
Okay.
4 to 5 days.
There. So I don't know if you heard that, but we're telling people around 7 days, but the results are coming back around 5 days. And how long should you wait after if you think you've been exposed? Really want you to wait 4 or 5 days because you have to have enough virus in your system for it to be detectable.
Okay. Also from Paul at WBIR, is there a day of the week when the health department is giving fewer tests? Is that why we saw new case numbers like we saw over the last few days? 93 new cases on Saturday, 17 on Sunday, 93 today.
I'm not sure I understand the question, but we are testing here at this location on Monday, Wednesdays, and Fridays, I believe from 9 to 3. And it just depends on public demand. It kind of goes up and down a little bit based on whether people want to come in and get tested. Additionally from Paul, why does it vary so much day to day? Because public demand changes.
And final question, why do you think the death rate is lower in Knox County as opposed to other metro counties in the state?
You know, that's a great question. And I'm sure afterward, when we have time to go back and look at the data and really dig into the data, we'll have more information to share about that.
From Claire at WUOT, the New York Times reported more than 200 experts sent a letter saying coronavirus is airborne. The WHO says it's inconclusive. Should our listeners treat the virus like it is airborne and potentially lingering in public spaces?
I think there's still a lot more science or a lot more to learn about this virus. And if the science does prove that it is airborne, that will change things. Right now, what we know for sure is it's a droplet. It's droplet spread. So it doesn't hang out in the air like chickenpox does. You got to have close proximity to the person to be able to get it. And that's what we know for sure. And science is changing and we're learning more about this virus. And we'll have to see if more evidence comes out to tell us something different.
Also from Claire at WUOT, we know that it may take a handful of days for people to develop symptoms and that after people get tested, there are a few more days for tests to be processed and results returned. Therefore, do current case count statistics really reflect the extent of COVID in Knox County several days ago? She also added, are we essentially looking at a short distance into the past?
Yeah, basically, you know, we're looking, so there's the time from when somebody gets ill to the time they decide to get tested. There's that lag time, and then there's the lab lag time. So yes, the folks that we're reporting on, there's no way to do this real time. You know, like some people are still sick right now because we just got the results back, but some people have recovered fully. And so, yeah, we're looking at the past with our case counts, really.
From Paul, WBIR, what can you tell us about the 3 deaths in the last week, ages and underlying conditions?
So we really aren't reporting much more than gender and age. So one was a 77-year-old man, one was a 37-year-old woman, and another was a 41-year-old man.
Also from Paul at WBIR, we didn't have any deaths for more than 2 months. Now we've had 4 in the last 5 days. Is this a trend or just a random bump?
Well, you know, we won't know until we see what happens, but it's not unexpected with our case counts going up.
From Alex with News Talk 98.7, what benchmarks must be hit in order to lift the county mask requirement?
The Board of Health didn't set any benchmarks for that. What they did commit to was evaluating every 2 weeks when they meet. So they didn't set any benchmark. There are no benchmarks attached to that.
From Austin at WATE, is there any more information on the demographics of deaths in the county?
None, no more than I just shared.
Okay. Also from Austin with WAT, more record spikes in cases this weekend and more deaths. Is it possible we could move back to phase 2 like Nashville?
That's something that the Board of Health would have to discuss and decide.
Also from Austin at WAT, we've had a big jump in cases. What does the ICU capacity look like?
We have had more hospitalizations and more people in the ICU, and we'll be reporting out on our benchmarks on Wednesday.
Also from Austin at WAT, what is the date for the possible case exposure at the visitor center?
I'm not sure what you're talking about. So
Yeah, Austin,
Yeah, and we don't talk about specific cases.
From Paul at WBIR, at what point would you recommend hospitals begin suspending elective procedures again?
Oh, that's really not a decision that myself or the Board of Health would make. That's actually a decision that comes from the state, or internally, the hospitals have regular meetings and discuss what they need to do. And they internally could also make that decision to cease elective procedures, which the first time that they actually did that before the governor made his order.
From Bob Morgan with the Knoxville Liberty Press, the community is under the impression that face masks are mandatory. While this is not true, as long as 6 feet of distancing is maintained. When will this be communicated properly to businesses and the general public?
Well, I feel like we've communicated it, but perhaps we haven't. So what the regulations actually available on our website, you can read it for yourself. And we are mandating face masks. One of the things that Dr. Shamia said actually at the Board of Health meeting was, the way we operate and the way we move around in our community, you never know when you're going to be closer than 6 feet to somebody. When you're going to stop and have a conversation with a friend in the grocery store or something like that. So we recommend really wearing a mask all the time when you're inside in a public place. If you can maintain 6 feet of distancing, you don't have to do that. But again, it's unpredictable when that 6 feet might get broken. And so we're recommending that people wear masks or mandating that people wear masks inside all the time.
From Paul at WBIR, does the speed of results vary whether the patient tests positive or negative?
I'm not aware that it does. And we've talked about the challenges of the negative test results coming to us because that's not a standard in public health for us to get all of the negative test results of everybody tested for all the reportable diseases out there. So we know that positive tests come to us more quickly and more reliably than negative tests do. So there is some variation, in part because of the system and in part because reporting negatives to us is a new activity.
From Vincent at the Knoxville News Sentinel, you mentioned that benchmarks would be updated differently now that the Board of Health is meeting regularly. Does this mean that updates occur every Wednesday? This does not change the daily update schedule, correct?
So we'll keep our briefings Monday, Wednesday, Friday, but we'll be updating benchmarks every Wednesday.
Okay. From Bob Morgan with the Knoxville Liberty Press, we are getting reports that patients are being transported to medical facilities within Knox County from outside our county. How are these accounted for within our Knox County numbers?
So first of all, Knoxville is a regional tertiary care center. So people get transferred here from other places around the region all the time for the medical care that we have here in Knox County. So when you look, so there are two things. When you look at the data for the benchmarks, that's regional data. So that's Knox County, the counties that surround us, and perhaps other counties. So that's regional data. The data that we report is just specific to Knox County residents, so it doesn't include those regional folks.
From Paul at WBIR, once you have COVID, how long do you have to go till you can be around other people again?
So somebody who has COVID is in isolation for 10 days from onset of symptoms or the date of testing if they don't have symptoms.
Also from Paul.
And they also have to be 72 hours without symptoms, without treating symptoms. So not taking any medication to bring your fever down. So that it's either 10 days or plus also 72 hours symptom free. And then some people have kind of lingered with that. And what they've found is that out 21 days afterwards, no matter what, if you have symptoms or not, you're not contagious.
Also from Paul, once you've had it and recovered, do you still need to wear a mask? You
do still need to wear a mask because we do not know what, if having COVID confers immunity to you. And so if you could possibly get it again.
All right. From Paul, WBIR, on average, how long does it take to trace one case? Also, the second part is how many cases can one person do in a day?
So it sort of depends on how many contacts they have because, so if the person only has about 10 contacts, that's a whole lot easier than somebody who has 20 or 25 contacts. So it depends on how many contacts they have and how easy it is to get a hold of those contacts. We set a goal of reaching out to cases within 24 hours of knowing they're a case. and we're accomplishing that. But sometimes it's like that they don't have the phone number of all their contacts, and so they have to. It takes time to get all that information. And our case manager or contact tracers can do about 5 to 6 cases a day.
Okay. Also from Paul, final question on this. How does having 93 new cases on one day affect your ability to trace cases?
It's really challenging. And that's why we're pulling in people to help support that. We actually brought some folks back from furlough today. And those folks will be, some of them, they'll be doing part of their regular job, but they'll also be supporting our response as well. So we are in full all hands on deck, helping with the response.
From Bob Morgan with the Knoxville Liberty Press. How did the new regulations get written and submitted for a vote without the health director having seen or having input on this matter? Dr. O'Brien spoke to that at the Board of Health meeting. He took it upon himself and gathered the resources he needed and wrote the order. From Claire at WATE, how do you think structural racism is impacting the racial and ethnic disparity in case counts in Knox County? That's a great question. I don't really have a really good answer for. I think when we look at our case counts, we have seen a larger burden in some communities. And we've worked really hard to outreach to those communities to reduce their risk and continue to do so with all of our at-risk communities. You know, structural racism existed way before the pandemic, and it is impacting people getting care, people getting testing. And we work every day to try to change that and try to allow people who might not otherwise have access to testing to get the testing that they need. But it's there and it's real. Also from Claire at WOT, to my knowledge, there are no Black or Hispanic members of the Board of Health, even though these populations are disproportionately impacted by the virus. Do you see this as a problem? And what steps are you taking to make sure these communities have a say in county policies? Well, those communities, like everybody else, can have input into the Board of Health via email or other ways people can provide information to the Board of Health. And I actually will correct you. There's at least one person of color on the Board of Health. And those people are nominated by their respective professional organizations. And again, that's set by Tennessee code. And so those nominations come from the Medical Academy, nursing, pharmacy, dental, and then the superintendent has a representative and the mayor's on the Board of Health. From Bob Morgan with the Knoxville Liberty Press, why are local hospitals not giving HCQ as an effective treatment method, which recent reports prove is effective in curing this virus? I think that's a great question for the hospitals, and doctors make their own choices about how they treat. Okay. From Paul at WBIR, this is a viewer question. What measures are in place to make sure those positive COVID-19 people are self-isolating? Well, we do what we always do. We check on them every day to confirm that they're staying home. And, for the most part, everybody's cooperating and staying home. They don't want to make other people sick. It's something we do regularly with other kinds of infectious diseases. So we're contacting them every day to make sure they're staying home. Also, from Paul at WBR, do the people coming from Myrtle Beach over the 4th of July holiday have to self-isolate and or be tested? We don't have any requirement for that. Also from Paul, a viewer question related to the face mask order. Does it apply to daycare facilities in the city and county that may also operate in schools during the academic year? It applies to daycare facilities, but public schools have been excluded because they fall under the Department of Education at the state level. Related to daycares, will KPD or whoever regulates daycare enforce this? We regulate daycares, and yes, we will be educating and informing and enabling people to be compliant. From Bob Morgan with the Knoxville Liberty Press, how many people in the room right now are wearing masks? One person in this room is wearing masks, but the rest of us are more than 6 feet apart from one another. We've talked about that arrangement in the past. So we have the setup so that I can take my mask off and be able to talk. And so
so you can understand me better.
Okay, from Vincent with the Knoxville News Sentinel, just to clarify, your criteria for releasing someone from isolation is the same as designating them as recovered, correct?
Yes.
Also from Vincent with the Knoxville News Sentinel, earlier in the pandemic, we heard from members of the public that they had erroneously been removed from the active case count. They had symptoms but were removed or lost symptoms using over-the-counter meds. To your knowledge, have discrepancies like this been addressed in your data collection?
I'm not familiar with people being removed. Certainly sometimes there's misinformation and people misunderstand or believe that they have an illness and turns out they don't really have it. Actually happens quite frequently. We get reports that so-and-so there's a case of something somewhere. And when we investigate it, we find out that it's not true. So we look into all possible cases and sometimes people determine not to be a case.
From Bob Morgan with the Knoxville Liberty Press, what are your thoughts about the Knox County Sheriff and the law director's actions that the new regulation order is unconstitutional?
That they certainly have their opinions, and you certainly can ask them more about that. When I look around the country and around the state, we see other jurisdictions passing similar ordinances that are appropriate. And I believe under Tennessee Code and as the Board of Health had full authority to pass this mandate.
All right, I believe we have time for one more question. From Paul with WBIR, you touched on this in your opening remarks, but how discouraging is it that masks have become such a divisive political issue?
It's really challenging. It's really challenging that the pandemic itself has become a political issue as well. COVID-19 is real. It's making people sick and causing people to die in our community. And it is not a partisan issue. It is an issue of our community's health and well-being. And, we're working hard to protect our community and educate and inform our community. And it creates a real challenge for our team members as they try to communicate and educate people regarding their health and safety and the health and safety of others.
All right, go ahead. We have time for one more question. If you want to go ahead and submit it in the chat feature. All right, well, thank you all. We will resume our media briefing on Wednesday at 12:30. Thank you.